85 to 90% of people with diabetes, and I'm referring to type 2 now. There's a difference. I think that when you say diabetes, people just think high blood sugar. There is a difference between those two diseases. But 85 to 90% of them die from cardiovascular related disease, heart disease or stroke. So that would be a big risk factor. Unfortunately, a lot of them don't even know they have diabetes. Okay, unless they go into the doctor and they have a blood work done upon them, an A1C or a fasting blood sugar to tell them if they do have diabetes or not. Because there are no symptoms of it outside of the fact that you may be overweight. Visceral fat would be a good indication. If you put it through the belly, okay, that's not a good area to store it. You have a higher rate of diabetes, developing diabetes with that. Be proactive, get control of it before you get it, because once you get it, then the medical profession is they're going to do their thing, is they're going to try to treat the symptoms. All right, you want to keep yourself from getting it before you get the disease, so you don't have to treat the symptoms. Their job is to try to keep things under control by using drugs. Your job is, as a person, is to try to get rid of the problem by changing your lifestyle. It's the most effective way to do it. Change what you've been doing. So if you've been doing the wrong thing and you have these problems, don't expect to make it any better just by taking a medicine. It's just going to mask the symptoms of the sickness. So you have to change what you've been doing. Heart disease in general, it afflicts so many people. You're looking at the #1 killer. And I think a bypass surgery, if I'm not mistaken, costs $60,000 to $70,000 just for a bypass surgery. Okay, stents run about $4,000 to $5,000. All right, so I mean, it's an expensive disease to have. And then all the other medications that they have you on once you have it, because you're going to be on cholesterol medication, you'll be on blood pressure drugs, you'll be on blood thinner drugs, you name it, you're going to be on it to try to, again, mask the symptoms or control the disease itself. Most don't know they have it to that extent until they start to have angina, chest pain, shortness of breath, and all of a sudden they're in the doctor, and the doctor says, you've got to have bypass surgery. It's too late then, because now you have a real serious problem. You have heart disease and they know it. We have about 75 million to 80 million Americans with high blood pressure. Get a blood pressure monitor for home. Check it regularly. Okay, and then stay on top of it. And there's one thing you do not want to play with is high blood pressure. You have it, you get on medicine. It's that simple until you get that stuff under control. Do not play with that, because the risk factor for high blood pressure is stroke. All right, and you don't want to have a stroke. I work with people who've had strokes. The regulation of cholesterol is not from the diet, it's actually in the liver. Majority of it's manufactured in the liver. And the best way to control that is to control sugar intake, because insulin is the hormone that tells the liver to make cholesterol. And insulin goes up when you do what? When your blood sugar goes up. And blood sugar goes up when you eat carbohydrates. So if you want to bring cholesterol down, then you watch carbohydrate intake. I know what I'm doing because I've seen the results with people. I put a lot of time into this over the years because I had health issues myself, and I was able to reverse those conditions, but just by changing my diet.